My name is Ariana and I'm going to be your nurse today, and I'm just going to be administering some inhaled medication for you.
The supplies needed for today are metered dose inhaler, spacer, and tissues. It is important to assess the patient's respiratory status before administration of medication to establish a baseline that can be used to evaluate the effects of treatment. Identify the amount of medication for inhalation remaining in the canister, and be sure to check your patient's identification with their wristband.
Can you confirm your name and date of birth?
Kelly Cox, 4/16/98.
Thank you.
Assist the patient to a seated position or high Fowler's. Ask the patient to rinse out her mouth and spit the fluid out. Shake the inhaler. Remove the mouthpiece cap of the inhaler and insert the mouthpiece into the spacer while holding the canister upright. Remove the cap from the spacer. Ask the patient to breathe out slowly and completely. Place the spacer mouthpiece into the patient's mouth and have her seal her lips around the mouthpiece. Ask the patient to slowly inhale and then hold her breath for as long as possible. Assess for change in respiratory status after medication administration. The term sliding scale refers to the progressive increase in pre-meal or nighttime insulin dose based on predefined glucose ranges. Today our patient's glucose is read at 220. We will use this formula to calculate the number of units in order to administer. Our patient will be administered 4 units. To administer a subcutaneous insulin injection, you will need a syringe and needle appropriate for volume and site, an alcohol prep pad, and a gauze pad. First, we're going to select an appropriate syringe and needle and draw up the medication. Today we are drawing up 4 units. For insulin administration, you have to have another nurse verify the type of insulin and the amount of insulin for your patient.
Hi, I'm Hannah, and I'm going to be your nurse today. I'm going to be giving you a subcutaneous injection of insulin.
Select an injection site. Scrub the injection site with an alcohol prep pad. Remove the needle cap. With your non-dominant hand, pinch the tissue at the injection site and determine the angle at which to inject the needle. Holding the syringe between thumb and index finger of your dominant hand, insert the needle at the appropriate angle. Using your thumb or index finger of your dominant hand, press the plunger slowly to inject the medication while stabilizing the syringe with your other hand. Remove the needle. Immediately after injection, dispose of the needle into the sharps box and blot the site with gauze if needed.